Hi and welcome back to another video of Medic Notes. This video is on tinnitus. Tinnitus is the perception of sound in the absence of an external auditory stimulus. Sounds heard can be intermittent or continuous, and have been described as variety of sounds, ringing, buzzing, humming, whistling, or clicking. The condition is common and affects around 10% of the population, with severe cases having a significantly detrimental impact on quality of life. The pathophysiology of tinnitus is not well understood. Current theories suggest it comes from abnormal neuronal activity along the auditory pathway, originating anywhere along the auditory pathway. Tinnitus can be classified as primary or secondary. Primary tinnitus, no underlying cause is identified, often associated with sensorineural hearing loss. Secondary, an underlying cause is identified, often further sub-classified into subjective, only heard by the patient, or objective, also audible to the examiner. There are many causes of tinnitus. Otological causes can be divided into conductive and sensorineural. Conductive causes include cerumen impaction, otosclerosis, and otitis media. Sensorineural causes are presbycusis, Meniere's disease. Medications, like NSAIDs, tetracyclines, quinine, sodium valproate, chemotherapy. Metabolic causes like hyperthyroidism and zinc deficiency. Neurological causes like acoustic neuroma and multiple sclerosis. Musculoskeletal causes such as TMJ dysfunction, tensor tympani, stapedius myoclonus. Psychological causes like anxiety and depression. Vascular causes like glomus jugulare, arteriovenous malformations, intracranial hypertension. Patients with vascular causes will often complain of a pulsatile tinnitus, which is one of the red flag signs. For clinical features, tinnitus will present in a variety of ways dependent on the underlying cause. Hence it is important to clarify certain features, including duration, character, symmetry, and associated symptoms, including hearing loss and focal neurology. On examination, otoscopy and audiometry are essential. Examine the cranial nerves and TMJ routinely for focal neurology. Specifically, in pulsatile tinnitus, auscultation of the temporal bone with a stethoscope can identify a dual fistula in those with an underlying vascular malformation. Tinnitus as an otological emergency. Current NICE guidelines recommend that patients presenting with tinnitus should be referred as an otologic emergency if they have features of sudden onset pulsatile tinnitus, significant neurology, severe vertigo, secondary to head trauma, or unexplained sudden hearing loss. For investigations, all patients presenting with tinnitus, particularly those with symptoms persisting for greater than 6 months, should be referred for comprehensive audiological assessment. Such assessments include pure tone audiometry, PTA, and tympanometry. Patients' blood pressure should be recorded as well. Most cases should have non-urgent blood tests sent, including full blood count, thyroid function tests, lipid levels, and blood glucose. Routine imaging of the head and neck is not recommended. However, if there is persistent unilateral pulsatile tinnitus, CT imaging with contrast will be indicated. MRI imaging of the internal acoustic meatus will be considered for persistent unilateral tinnitus, especially if associated with unilateral sensorineural hearing loss. For management, for the vast majority of affected, conservative management and reassurance is all that is required. Tinnitus is usually mild and will self-resolve over time. If an underlying cause is identified, this should be managed accordingly. For primary case, the focus of management is mainly centered on habituation to the symptoms. Tinnitus retraining therapy and cognitive behavioral therapy have both also been shown to be effective at reducing the impact of tinnitus. As tinnitus is often accentuated in quiet environments, patients with concurrent hearing loss have been shown to benefit from the use of hearing aids. In some cases, tinnitus masking devices are available which emit a constant, low-level white noise which help to distract patients. There is a limited role for surgery in the treatment of tinnitus. No pharmacological treatments are recommended at present for the treatment of tinnitus. That's all for this video. Thank you.